Endo-illuminators are used by vitreoretinal surgeons in their procedures. Numerous studies have substantiated the regular use of endo-illuminators in the daily practices of anterior segment surgeons. In some instances, they have been even likened to a magic wand.
Like a magic wand when you can't see.
Nevertheless, we find ourselves depending on our vitreoretinal peers to borrow the equipment for our procedures. Most of the time we ask for it, the response is primarily due to the unavailability of the machine or the illuminator. Published studies indicate that anterior segment surgeons utilize endo-illuminators through the pars plana route for cataract surgery in patients with corneal scars. Pediatric surgeons employ them intracamerally to enhance visualization of the posterior capsule during procedures like posterior capsulotomy and automated anterior vitrectomy. Corneal surgeons, in turn, use endo-illuminators as an extracameral device during surgeries such as EDMK and EPDK. This usage aims to improve depth perception and enhance the visualization of the graft, consequently minimizing graft damage attributed to prolonged surgery, excessive fluidics, and unnecessary manipulation. A short survey was circulated within our department to assess usage, and all corneal surgeons express a substantial need for a dedicated anterior chamber endo-illumination system, particularly for patients with corneal scars and also for various other cases. Furthermore, all of them express the desire for seamless integration into their existing surgical setups. Therefore, there exists a significant gap that needs to be addressed. Our objective is to develop a specialized endo-illuminator tailored for anterior segment surgeons. We adopted a three-pronged strategy. Version 1.0. A cost-effective endo-illuminator, easily accessible for immediate use by anterior segment surgeons. When we began seeking a solution, we discovered that a new light pipe accompanies each cassette. Consequently, we realized we could repurpose these for our immediate needs. The next challenge was the light source, for which we opted for the most commonly and readily available torch. The simplest and quickest resolution was to connect these two components. Thus, we 3D printed an adapter, and presto, a low-cost endo-illuminator was at our service. We tested the system, and it delivered ample illumination necessary for visualizing the anterior chamber structures in patients with corneal scars. We also applied it to a patient with leukomatous opacity, achieving satisfactory results. Advantages encompass immediate availability, a straightforward assembly process, accessibility for anterior segment surgeons, a cost-effective alternative, and an environmentally friendly approach, reducing the carbon footprint. Drawbacks included the necessity for a brighter illumination source and the requirement for a light pipe. However, with this system in place, when we request the nurse for the endo-illuminator, our next phase involves sourcing a more powerful illumination provider, such as one equipped with multiple LEDs instead of a single unit. The ultimate stage would entail replacing the light pipe and crafting a dedicated, comprehensive endo-illuminator, meticulously designed to meet the unique requirements of anterior segment surgeons. Diverse attachments can be conceptualized which can be affixed to the endo-illuminator to uniformly illuminate the anterior segment. The possibilities are limitless. Thank you.